In my 12 years of nursing, I have seen something that never stops surprising me. Some of the most unwell patients I have cared for were not suffering from a complicated disease. They were not dealing with a rare condition. They were dehydrated, chronically, quietly, without having any idea. Fatigue they blamed on aging, confusion their family thought was dementia, headaches they treated with painkillers for months, constipation they had accepted as normal, dizziness they assumed was just getting older. In many cases, the answer was water, or more specifically, the lack of it. Here's the thing most people don't realize. By the time you feel thirsty, your body is already dehydrated. And in older adults, that thirst signal becomes even less reliable over time. Your body stops sending it clearly, so you don't drink. And the damage builds quietly. Today, I am going to tell you exactly what happens. Let's start somewhere most people don't expect, your brain. Your brain is approximately 75% water, and it is extraordinarily sensitive to even small changes in hydration. Research shows that fluid loss impairs concentration. A loss of just 1 to 2% is enough to measurably impair concentration, memory, and decision-making. For a 150-pound person, that is less than 2 pounds of fluid. You would not even notice losing it, but your brain would. Mild dehydration causes headaches because as fluid drops, the brain temporarily reduces in volume and pulls from the skull. It causes brain fog, or that inability to think clearly. It also causes fatigue that no amount of rest seems to fix. And it causes mood changes, irritability, anxiety, and low mood that people rarely connect to something as simple as not drinking enough water. In older adults, the consequences go further. Dehydration is a common cause of sudden confusion in seniors. I have watched families bring a parent to the hospital convinced something serious happened, only to find fluids fixed it. If someone you love seems suddenly more confused than usual, hydration is always one of the first things we check. Your kidneys are the organ most directly and most immediately affected by not drinking enough water. Every single minute, your kidneys filter around 1.3 liters of blood, removing waste products and toxins. When fluid intake drops, the kidneys respond by concentrating urine, holding onto water to conserve it. That concentrated urine is darker in color. This is why urine color is one of the most reliable hydration checks. Dark yellow means you need fluid. If it is dark brown, that is a signal to seek medical attention immediately. Chronic low fluid intake forces kidneys to work harder. The risk of kidney stones rises significantly. The biggest drivers of kidney damage are blood pressure and diabetes. Chronic dehydration adds a third driver. Protecting your kidneys starts with something as simple as drinking enough water consistently throughout the day. Your heart and your entire circulatory system depend on adequate fluid to function properly. Here is something worth understanding. Your blood is approximately 90% water. Dehydration makes it thicker. Your heart now has to work harder to push that thicker blood through your vessels. Heart rate increases. Lower blood volume triggers the body to constrict blood vessels to maintain pressure. That constriction raises resistance. Dehydration reduces the ability to regulate temperature through sweating, putting more strain on the heart and heat. If you are on blood pressure medication, staying hydrated is not optional. It is part of managing your condition. Beyond your brain, kidneys, and heart, dehydration affects several other systems you might not connect. Your joints. The cartilage cushioning your joints is approximately 80% water. Hydration keeps it plump and flexible. When you are chronically dehydrated, joint stiffness increases, pain increases. Dehydration is a tool you can manage. Water is essential for moving food through your digestive system efficiently. Without enough fluid, your colon pulls water from its contents to compensate, leaving stool hard, dry, and difficult to pass. Chronic dehydration is a common cause of constipation. Before a laxative, try increasing fluid intake consistently. Your energy. Every chemical reaction that produces energy requires water. Dehydration slows these reactions down. The result is that heavy, persistent tiredness that makes everything feel harder, and that no amount of sleep seems to fully fix. So how much water do you actually need? The general guidance is around 6 to 8 glasses per day, but individual needs vary based on your size, activity, temperature, and health conditions like diuretics. The simplest guide is your urine color. Aim for a pale straw color and check it every time you use the bathroom. For seniors, do not wait for thirst. Build hydration into your routine. A glass first thing in the morning. A glass with every meal and every medication. Small, consistent amounts are better than large amounts at once. Water is best, but herbal tea, diluted juice, and water-rich foods like soups all contribute to your intake. If you forget to drink, set a reminder on your phone. Use a marked bottle. Ask family to remind you. Your body is 60% water. Every system works better when that is maintained, and it requires nothing more than a habit. Everything I share comes from my nursing experience. Please always speak with your own doctor about personal needs. This is education to work alongside your medical team, not instead of it. Stay healthy and stay hydrated. If you found this information helpful and want to learn more, click one of these videos on your screen right now. I made them just for you. Let me know what you'd like to hear about next. Thanks so much for watching, and I'll see you in the next one.